Seniors and cancer, the 7 most common types, and how to beat them. Hello and welcome to the channel that's all about living your best, healthiest life after 60. In today's episode, we're talking about something that affects millions of people around the world, especially older adults, cancer. Now, I know that's a heavy word. For many, it brings up fear, worry, and questions. But here's the thing, knowledge is one of our best tools. When we understand the kinds of cancers that commonly affect seniors, and when we know what signs to watch for, what treatments are available, and what steps we can take to protect ourselves, we take back control. So whether you're here for yourself, a spouse, a parent, or just want to be informed, this episode is for you. Let's take a deep breath together, and start this important journey. Segment 1, Why Cancer is More Common in Seniors. So why exactly does cancer become more common as we get older? Well, it starts with our cells. Every day, our bodies are working overtime, cells dividing, healing, renewing. But over time, tiny errors can occur during that process. Normally, our immune system catches these abnormal cells and clears them out. But as we age, the immune system isn't as sharp as it once was, and some of those rogue cells start slipping through the cracks. Add to that decades of exposure to environmental toxins, chemicals, stress, processed foods, and other risks, and you have a higher chance of developing cancer. But don't let that get you down. The good news is that many types of cancer grow slowly in seniors, and modern treatments are more effective and personalized than ever before. The key is early detection and healthy living. Let's break down the 7 most common cancers affecting seniors and what you can do about them. Segment 2, Colorectal Cancer. First up is colorectal cancer, which affects the colon or rectum. It's actually one of the most preventable and treatable cancers out there if caught early. For seniors, especially those over age 60, it's incredibly common. Many people don't experience symptoms until the cancer is more advanced, but there are some subtle warning signs to look out for. These include blood in the stool, unexplained weight loss, a change in bowel habits, or persistent abdominal pain. That's why screening is so critical. A colonoscopy can detect and remove polyp small growths that could turn into cancer. And here's the truth, most colon cancers begin as polyps, which can be removed before they become dangerous. Lifestyle also matters. Eating plenty of fiber from fruits, vegetables, and whole grains, staying physically active, and limiting red meat can significantly reduce your risk. So don't skip your colonoscopy, it's a powerful step toward prevention. Segment 3, Prostate Cancer. Let's talk about prostate cancer, which is one of the most common cancers among senior men. The prostate is a small gland located below the bladder, and as men age, it's not uncommon for changes to occur there. Many prostate cancers grow slowly and might never cause symptoms or become life-threatening. However, in some cases, the cancer can be more aggressive. Symptoms may include difficulty urinating, a weak urine stream, or discomfort in the pelvic area. The key tool for detection is the PSA blood test, which measures prostate-specific antigen levels. This, along with a digital rectal exam, can help detect prostate issues early. Treatment options vary. Some men choose active surveillance, where the cancer is monitored closely but not immediately treated. Others may need surgery, radiation, or hormone therapy. It all depends on the cancer's stage and the individual's overall health. The important thing is to stay in touch with your doctor and weigh the options that are best for you. Segment 4, Breast Cancer. Now, let's talk about breast cancer, which primarily affects older women, though men can get it too. After menopause, the risk increases, especially with certain genetic factors or a family history. Symptoms include a lump in the breast, changes in the shape or size, dimpling of the skin, or nipple discharge. But sometimes there are no symptoms at all, that's why mammograms are so important. After age 60, it's recommended to have a mammogram every 1 to 2 years, depending on your health and risk factors. When caught early, breast cancer is very treatable, often with a combination of surgery, radiation, and medication. And today, we have incredible advancements like hormone therapy and precision medicine, which target the cancer without harming other parts of the body. Beyond treatment, a healthy lifestyle, maintaining a balanced diet, limiting alcohol, staying active can make a big difference in prevention and recovery. Segment 5, Lung Cancer. Lung cancer is another major concern for older adults, particularly those with a history of smoking. Even if you quit 20 or 30 years ago, the damage from earlier years can still increase your risk. But here's something important: not all lung cancer cases come from smoking. Environmental exposure, genetics, and even air pollution can play a role. Symptoms include a persistent cough, coughing up blood, chest pain, hoarseness, or shortness of breath. Often, people dismiss these signs as just a cold or part of aging, but don't ignore them. If you're a former smoker aged 55 and up, ask your doctor about a low-dose CT scan, which can detect lung cancer early when it's most treatable. Treatments now include not just chemotherapy and surgery, but also immunotherapy, which uses your own immune system to fight cancer cells. Quitting smoking, if you still do, remains one of the best things you can do for your health, no matter your age. Segment 6, Skin Cancer. After decades in the sun, skin cancer becomes a real risk for seniors. There are different types: basal cell carcinoma, squamous cell carcinoma, and melanoma, the most dangerous kind. Many seniors were sunbathing long before sunscreen was the norm. The damage done earlier in life often shows up later. You might notice a mole that's changed in color, size, or shape, or a sore that doesn't heal. These could be warning signs. The good news: skin cancer is one of the most treatable cancers when caught early. Treatment may include freezing, excision, or topical medications. For more serious cases, surgery or radiation may be needed. Prevention is simple: wear sunscreen daily, avoid tanning beds, and see a dermatologist once a year. Wearing a wide-brimmed hat and protective clothing can also make a big difference. Your skin is your largest organ, so take care of it. Segment 7, Bladder Cancer. Bladder cancer might not get as much attention, but it's actually quite common among older adults, especially men. One of the earliest signs is blood in the urine. Even if it only happens once, it needs to be checked out. Other symptoms might include frequent urination or pain during urination. Smoking is the leading risk factor, followed by certain chemical exposures over time. Diagnosis usually involves a urine test, imaging, and a procedure called a cystoscopy, where a small camera examines the bladder. Treatment varies depending on the stage, but may include surgery, chemotherapy, or immunotherapy that targets the bladder directly. Regular checkups are important, especially if you've ever worked in industries with chemical exposure, or if you smoked in the past. Segment 8, Pancreatic Cancer. Pancreatic cancer is one of the more aggressive types, and unfortunately, it often goes undetected until it's advanced. It usually affects people in their 70s and 80s. Early signs include upper abdominal pain, back pain, jaundice, loss of appetite, or unexplained weight loss. Because the symptoms are so vague, it's often misdiagnosed at first. But things are changing. Research into early detection, genetic testing, and targeted therapies is making progress. If you have a family history of pancreatic or related cancers, talk to your doctor about possible genetic screening. Newer treatments, like immunotherapy and clinical trials, are showing promise, especially when combined with traditional options. While it remains a difficult cancer, there is hope on the horizon thanks to medical innovation. Segment 9, Holistic and Supportive Solutions. Now, let's step back and talk about supportive care, which is essential for every senior facing cancer. Cancer treatment is not just about fighting the disease. It's about supporting the whole person. That means nutrition, mental health, physical comfort, and emotional resilience. A diet rich in antioxidants, healthy fats, lean proteins, and low in processed sugars can support your immune system. Gentle exercise like walking, yoga, or stretching helps maintain strength and mobility. Emotional well-being matters too. Meditation, journaling, faith, or support groups can be healing. And then there's palliative care, which isn't about giving up, but about living well. It focuses on pain relief, emotional support, and quality of life during and after treatment. Ask your healthcare provider about integrative care options, including acupuncture, massage, or art therapy. Healing is holistic. Segment 10, Prevention and Early Detection. Before we wrap up, let's revisit the most powerful tool you have, prevention. Regular checkups. Annual screenings. Talking openly with your doctor. Don't wait for symptoms, be proactive. Get those mammograms, colonoscopies, PSA tests, and skin checks. Know your body. Know your family history. Stay active, eat well, and keep learning. Vaccines also matter, like the HPV vaccine, which can prevent cervical and throat cancers, and hepatitis B, which is linked to liver cancer. You're never too old to start taking control. Prevention might not be flashy, but it's powerful. That brings us to the end of today's important journey. Cancer is a big topic, but I hope this video made it feel a little more manageable, and a lot more hopeful. Remember, age does not mean you're powerless. With early detection, smart choices, and supportive care, seniors can live strong, vibrant lives, even in the face of cancer. If you found this episode helpful, please hit the like button, share it with someone you care about, and subscribe for more senior-focused health content. Leave a comment below if there's a topic you'd like us to explore next. Until then, take care of yourself, stay informed, and as always, stay strong and keep shining.